nutrition can be, and I think in the future years will be very specific to the kind of DNA situation you have. I'm going to a conference, I think in 3 months, where one of the main topics is going to be nutrigenics. And that's where matching the nutrition based on your genetic code is important. So what you want to do is have a diet that helps to protect your DNA. You know, some people call it an anti-inflammatory, plant-based diet, but a diet that really helps protect your DNA, and that would be one that's extremely high in vegetables, has some protein in it, you know, to a smaller extent, fresh fruit in it too. So that would be the main prevention diet. And of course, with that is, you know, limiting the simple sugars, also limiting alcohol. The Surgeon General came out not so long ago saying that really when you look at diseases, particularly cancer, no alcohol is better than even the 1 or 2 glasses that some people, you know, suggest. So, but when I talk about the diet for prevention, it would be that picture of the plate, a diet that is high in phytochemicals. And it's plant-based, it's not necessarily vegetarian, but at least half your plate is going to be vegetables. So if you're doing that, you're doing your body a wealth of good. The number one thing, I work with cancer, if you're already suffering from cancer and you're going through treatment, is it depends a lot on your side effects. So many of our patients, they're losing weight and they barely can keep, you know, 500 calories down a day. With those patients, I would work, you know, can we control the nausea? Can we control the diarrhea? And for them, I tell them, eat as healthy as you can. But if all you can tolerate one day is vanilla wafers, always remember when you're losing weight and you're not eating much, any food is going to be better than no food. So it's kind of important to realize the idea that we're going to starve ourselves to prevent cancer, that's not really going to happen, and it's not going to be beneficial to the patient. If they show up every week losing 5 or 10 pounds because they're trying to follow a perfect diet, then you know that alone is going to be inflammatory, and their immune function isn't going to be very good. There are certain types of cancers that will be fine with just surgery or just a minimum amount of chemotherapy, and some may actually be in a holding phase for 20, 30, or 40 years. So back to the question, can we cure our cancer with food? We can certainly improve our outcomes with it. If you're eating a plant-based diet, you know, much of the research shows you're going to have a better outcome than if you're eating a diet that's highly inflammatory. As far as curing it, say comparing a food intake with chemotherapy, the research is just not there, at least not right now, that you can cure your cancer with food alone. But as I said, you can certainly improve your outcomes. If you are eating a diet that's low inflammation, high plant-based, you can improve how your body reacts to the chemotherapy and how you recover from all your treatments. I did a conference here at Baptist about 2 years ago on does sugar feed cancer? And the research bears out it's not quite that easy. What it boils down to is that we need to kind of limit the amount of times our body's releasing insulin. And it releases insulin based on our carbohydrate intake. What we have seen that research bears out that I could say does feed cancer is we know that the body percent body fat is going to be a stronger indicator of cancer than even the amount of sugar you take in. So, for example, when I'm working with breast cancer patients, I said, definitely, watch the amount of sugar you're taking in, but one of the best things you can do is get your body as lean as possible. A research I just shared with our breast cancer surgeons last week was they found that even women with a normal BMI, those that had a higher percentage of their body as fat, even though they may be skinny, had a higher chance of having breast cancer. With breast cancer, the correlational studies show that most breast cancer patients do not benefit from a high-fat diet. They're better off having a plant-based diet where at least half your plate is going to be vegetables of a wide variety, fourth of the plate is going to be protein, and then that last fourth is divided between, say, a fruit or a whole grain. And for the breast cancer patient, we may or may not be pushing an increased dairy intake. You contrast that to the prostate cancer patient, where we actually may say, go down a little bit on your dairy intake at that time. So those are two different types of cancers, and it's not a one-size-fits-all. One of the things I'll talk about is, the plant-based diet, doing what you can to limit the sugars and the sweets, not too much fat in the diet, limiting the alcohol, but also I really zone in the need to have our bodies active, really getting physical. We have seen that as women, as we get older, we just tend to have more body fat if we don't work at it. So by limiting the percent body fat, you can help yourself out a lot with several versions of cancer. The keto diet is not ready for prime time. It has a lot of value to it, and a lot of universities are looking into it. There's been some research where the keto diet with chemotherapy is helping slow the progression of certain types of cancer. But unfortunately, with many cancer cells, the cells adapt to the lack of carbohydrates and learn in a few months' time how to feed off of the fat cells. So there's a lot of research that still needs to be done on that. The most promising has been with stage 4 glioblastoma, but still, that's, some people have benefited and some people actually got worse. So right now the ketogenic diet is under review at different universities, and I don't think it's really something that I'm going to be recommending at this time. Now that could change in time to come. There are a lot of diets, if you went to the bookstore to see them, there are a lot of diets that are keto friendly or ketogenic-like. Now those are not as restrictive. A true ketogenic diet developed for epilepsy in 1920s is about 10 grams of carbohydrate and no more, and then you're existing on fat, and the idea is to promote ketosis, to have your body feeding off fat cells versus relying on carbohydrates for food. And that was somewhat effective for the epileptic patient. You can lose a lot of weight that way because your body is resorting to fat for fuel. The problem is, what is the long-term overall outcome? And unfortunately, the research, even outside the United States, isn't too promising with low carbohydrate diets. They show mortality is increased with the low carbohydrate diets. So most practitioners, they want you to live a long, healthy life into your 90s and be happy and everything. So they usually are going to promote more of a moderate carbohydrate diet. But back to the ketogenic diet, it's a darling diet, that's out there today, and a lot of people are following it. And I think if you do a low carbohydrate diet that's rich in the vegetables that I mentioned, help to preserve your DNA, then I think that would be fine. Get rid of the cakes, cookies, pies, sweets, and focus on just having carbohydrates that are healthy. And there are a lot of diets out there, the Mediterranean diet, the South Beach diet, Clean 30, that are promoting a diet that's got carbohydrates, but most of the carbohydrates are going to be healthy. I guess the terminology is the cancer cells feed off any nutrition. And like I was saying with the ketogenic diet, the research was very promising in the beginning. Oh, it's slowing down the cancer cells. But some research has shown with certain types of cancers that the cell adapts and can, exist with the fat intake. So, the cancer cells do adapt, and they can exist with a healthy diet, and they can exist with a not so healthy diet.
So are there any other scenarios like the keto we were just talking about where that research has shown that that type of stuff can happen?
I think the keto diet is certainly the one that's getting the most research right now. The other diets that I've seen are basically going to be the sugar-free diet, a higher protein diet, but we haven't seen anything that just stops cancer in its tracks with the diet alone. But what we have seen is, as I was mentioning, what I talk about with breast cancer patients is certain diets, the recurrence rate is a little higher when there is a higher alcohol intake, when there is a higher fat intake, when the body is a higher percentage of fat. So the alkaline diet basically purports that if you have less acid in your diet, that your body will be doing better. The interesting thing about the alkaline diet, if you look at it, it's chiefly a plant-based diet. So I think the benefit that you see from the alkaline diet is it's a plant-based diet. So a diet that's high in vegetables and fruits is going to be more of an alkaline diet. And then the acid would be more the meats, the fats, and the inflammatory foods.
But drinking the alkaline water.
Yeah,
Can you
we don't.
Can that stop your cancer cells drinking?
Thankfully, your body is going to balance that, because if your body became totally alkaline or totally acidic, you'd have some real issues. So your body is a neutralizing agent. So the alkaline water, they've done a little research, not a lot of research with it. They haven't found that it's particularly beneficial. However, if you do follow the alkaline diet, you're eating a wonderfully high plant-based diet. So that part is good.
What do you tell somebody like me or anybody else who kind of doesn't know what to do?
To eat from it. Well, usually what I do is we talk about a 24-hour diet recall. Like I talked to you about what you've eaten in the last 24 hours and different things that can help. I was going to mention to the side that intermittent fasting is something that a lot of researchers are looking at. And intermittent fasting is when you might have 5 days of eating, slightly less, and then 2 days of eating normally. Or, which I like to promote, is the evening to the morning, that you have at least a 12 to 15-hour fast. And the research shows, there is some benefit to that, but a lot of research is still ongoing with that. Well, what I tell patients is if you Google something that flashes up and you're interested, take a look and see, are they selling something? Are they selling a supplement? Are they benefiting from having this website up there? And chances are they may. The best thing, of course, I'm going to, contact a registered dietitian, particularly somebody that's board certified in oncology that you can talk to, and they can get you through, the weeds as far as what's good, what's bad, what's kind of hocus pocus out there.
Well, that's the thing too. It's like everyone's like, "I'll sell you this for 12. Get my secrets." And I'm like going through these pages. I'm like, "Well, why can't you just tell me? Why do I have to pay you $29.95 if you've got the world?"
Well, and if it was that good to kill cancer of a specific type, then it would be utilized. Because here at Baptist, we have several researchers, several clinical trials. MD Anderson had several clinical trials, and most universities do, looking carefully at each and every type of medication, scenario, nutrition protocol, to see if we can, kick cancer. The cancer patient, when you get the diagnosis of cancer, as you may know, it's kind of a shock to the system. I mean, you're in a state of disbelief, and then you go, what can I do? And you want to do everything possible. So what frustrates me is that the cancer patient is probably the most vulnerable patient for buying anything that sounds like they could cure, their disease state. So the hocus pocus out there, I've seen everything from going to clinics in Mexico to get a spirulina injection, to different people here selling certain nutrition things. And unfortunately, with the supplement industry, it's not as regulated as pharmaceuticals. And so I can sell you, a lot of vitamins and minerals, and I can tell you that they do a lot of things, and I don't have to really have the research behind it. So that's where the patient definitely has to talk to their doctor and discuss what they're taking, what they want to take. At this time, the research is out there. The supplements do not work as well as the food itself. Our bodies were made to get the nutrition from the food, absorb it through your GI tract, and assimilate it that way. That's the best way to get it. One of the popular things is to get intravenous vitamins and minerals and supplements. And what we're realizing is the body's a delicate instrument. And if you give massive doses of, for example, vitamin B12, research is coming out that smokers that take a lot of B12 have an increased risk of lung cancer. So what we generally guide our patients is try to avoid the high dose. Get your vitamins and minerals from the food itself. If a patient is not eating particularly well, the doctor and I may agree that, a low dose multivitamin, Flintstones vitamin while they're going through treatment should be okay. But remember that a lot of supplements interact with the chemotherapy. So it's important to get your nutrition from the food. let's say that you're taking, as I mentioned, a massive injection of B12. Well, then you're going to increase your risk, particularly if you're a man, of lung cancer. Now, the beauty of going to a clinic such as this is that before you get your treatment, they're going to look at your lab work and, look and see what your magnesium is, your potassium is, and decide if you need to supplement that. So when your physician is looking at your lab work and carefully looking at it between treatments, that's something different. He's able to monitor whether you should get a supplement, whether you should not get a supplement. However, a lot of these IV clinics, they're really not looking at your lab work from day to day, at least the ones that I've heard about. So you could get a high level of vitamin C or a high level of magnesium and have a vitamin and mineral imbalance, and that can create a lot of problems. If you look at the research, it's kind of boring. It's not as interesting as getting an IV shot of vitamin C. But if you look at the research, it's pretty clear, and they've done the research to show that getting your nutrients such as vitamin C, B12, magnesium from the food itself, the body does the best with. When they say you can't fight genes, one of the things that we want to make sure we do is we want to eat a diet that protects our DNA. And that gets back to what I'm saying over and over again. It's a diet that's high in phytochemicals, the vegetables and the fruits and the whole grains, is your best strategy for protecting your DNA. And that's really what it is. As we get older, our body's DNA may start to break down, and the diet that's high in phytochemicals can help prevent that from happening. One thing I say to patients, because they say why do older patients get more cancers, is that every single day it's been estimated that we get 6,000 hits amongst our cells trying to develop cancer. And our body's natural protective mechanisms shut that down. Sadly, as we get older, or with some genetic things and how we live and how we eat, that mechanism of shutting down the cancer is not as effective as when we were younger.
6,000?
And they say 5,000 to 6,000 times a day.
Your
Different
body's
cells
cells.
in your body are, this could develop into cancer, but your body's own immune function. So that's why we encourage the diet that protects your immune function and keeps you, as healthy as possible.